I'm going to discuss some important questions or a couple of important questions that has been repeatedly asked for different GCC exams. Okay, and enlargement of the air spaces distal to the terminal bronchioles. Okay, so distal to the terminal bronchioles. Again, suppose if the patient is having a barrel chest. Okay, so suppose the patient is having a barrel chest, how the patient will look like. So we are having classes for all GCC exams or all licensure exams. We are conducting classes, so you can join us. Hi all, welcome back to Eduooz International Academy. So today I'm going to discuss some important questions or a couple of important questions that has been repeatedly asked for different GCC exams. Okay, so let me discuss the first question. So the first question states like this. That is actually for our GCC exams and all, we'll get most of the scenario based questions. Okay, so our role is to identify the priority or the probable things about the patient. Okay, so we'll get practical scenario based questions, and we have to go through, we have to go through that situation, and we have to identify the answer. What will be the answer? Okay, so the first question is a 65-year-old chronic smoker presents with progressive dyspnea and barrel shaped chest. Okay, what the patient presents with? Progressive dyspnea as well as a barrel shaped chest. Next, his lungs show loss of alveolar valves. Okay, the alveolar valves has been destructed, and enlargement of the air spaces distal to the terminal bronchioles. Okay, so distal to the terminal bronchioles, the areas or the air spaces are actually enlarged. What's the probable diagnosis of this patient? See, option A is chronic bronchitis, option B is emphysema, option C is asthma, and option D is bronchiectasis. Okay, so let me discuss the scenario in detail. Okay, so we'll see as the question says the patient was having barrel chest. Okay, so we'll see what is a barrel chest, how it is been defined and all. Okay, so as we can see in this image, this is actually a patient who is having normal chest. Okay, so normal chest means we'll see two diameters. Okay, two diameters means one is anterior posterior diameter. Okay, anterior posterior diameter means the diameter from anterior portion of the chest to the posterior portion of the chest. Okay, so that is what is called as what? Anterior posterior diameter. Okay, next we'll see what parameter, that is transverse diameter. Okay, so transverse diameter is actually side to side diameter, right? Okay, so that is from left side of the chest to the right side of the chest. That diameter is actually called as what? Transverse diameter. Okay, so normally what happens is this transverse diameter is large. Okay, this transverse diameter is large than the anterior posterior diameter, or this transverse diameter is 2 times than the anterior posterior diameter of the chest. That is actually the normal finding. Okay, this is a normal chest. Again, suppose if the patient is having a barrel chest. Okay, so suppose the patient is having a barrel chest, how the patient will look like means the anterior posterior diameter. Okay, anterior posterior diameter as well as the transverse diameter. Okay, transverse diameter, that will be equal. Okay, that will be equal. So that is what is called as barrel chest. Means how this barrel chest will occur. Why? Because of the trapping. Okay, because of the trapping of air in the lung alveoli. Actually, that is the basic mechanism or basic cause regarding this barrel chest. Okay, so we'll see what is emphysema. Okay, what is emphysema? So emphysema means a chronic obstructive pulmonary disease which is characterized by irreversible enlargement of the air spaces. Okay, so the patient is having what? Irreversible enlargement of the air spaces distal to the terminal bronchioles, means away from the terminal bronchioles, the patient is having irreversible enlargement of the air spaces, which is again been accompanied by destruction of the alveolar valves. Okay, so the patient is having what? Destruction of the alveolar walls will be there without significant fibrosis, means the patient's lungs will not have any sort of fibrosis. Okay, so that is what is called as emphysema. Okay, emphysema. So again, another thing I wanted to tell you, that is actually the COPD. Okay, COPD. So it is having basically two disease conditions. Okay, COPD means chronic obstructive pulmonary disease, and one component of the COPD is actually what? Emphysema. Along with this emphysema, the patient will have what? Chronic bronchitis. Okay, the patient will have chronic bronchitis. So the patient is having either chronic bronchitis or emphysema, then we'll call it as chronic obstructive pulmonary disease. Okay, so then we'll see what are the significant findings of this emphysema. Okay, so the patient will have, first thing, enlarged air spaces. Okay, the air spaces will be enlarged. And second one is the septa. Septa means in the alveoli is having certain surrounding wall like structures. No, so that will be very thin, or sometimes that space will be lost. Okay, then loss of alveolar valves will be there. So these all are the significant findings that you will be able to find out in a patient with emphysema. Okay, so what was the question? That is a 65-year-old chronic smoker presents with what progressive dyspnea as well as a barrel shaped chest. So his lung shows loss of alveolar walls and enlargement of the air spaces distal to the terminal bronchioles. What's the probable diagnosis in this patient? So the correct answer over here is option B, that is emphysema. Okay, so what is, we'll just discuss the other options also. So what is a chronic bronchitis? That is actually the dilation or the inflammation of the bronchus. Okay, so that is what is called as chronic bronchitis. Okay, so that is actually bronchitis, and if this bronchitis will be there for a prolonged period of time, then we'll call it as chronic bronchitis. Then what is asthma? Asthma is actually reversible. Okay, reversible sort of airway inflammation, that is actually called as asthma. Then what is bronchiectasis? That is again abnormal dilation, enlargement of the bronchioles. Okay, so that is what is called as bronchiectasis. Okay, bronchiectasis. So here actually the correct answer is option B, that is emphysema. Okay, so we have discussed two questions, and like this actually you will be able to, or you will be getting the similar type of questions for your main GCC exams also. So we are having classes for all GCC exams, or all licensure exams. We are conducting classes, so you can join us and you can win your exams, and you can settle in whichever country you want. Okay, so thank you once again.